Good morning. Today I would like to welcome Bruno Malfrici. Bruno is a renal dietitian at Nottingham University Hospital, and today he's going to talk about a healthy diet for kidney cancer patients. But first, Bruno, would you like to give us a short introduction to yourself?
Thank you for Action Kidney Cancer for having me today. And I've been working as a kidney dietitian for the past 17 years. So ideally, I do see sometimes people with kidney cancer, but predominantly I work with people on dialysis or where the kidney function is dropping, so in the nephrology clinic. Nice to meet you, and thank you for having me today.
Our pleasure. So one of the main questions that kidney cancer patients after they've been diagnosed is, does that mean that they have to change their diet?
So generally speaking, no. So people that are diagnosed with kidney cancer should follow a healthy, balanced diet. There isn't necessarily a need to change the diet dramatically unless your healthcare professionals or your oncologist, your nurse, or your own dietitian advise you to do so. So either pre or post-surgery, if you decided to have surgery, or during your treatment, if there are changes to your diet, then you should be guided really by your whole healthcare professionals.
Okay, thank you. So at what kidney function level would you need to start considering changing your diet?
So most people with kidney problem, either with kidney cancer or without, they really need to change the diet when the renal function maybe drops down around 30%. So we use a value called EGFR, so estimated glomerular filtration rate, which is a number that tells us the percentage of our kidney, how much are they working.
What would you remove or add or change in your diet if that happens to be where you find yourself?
Yes, so the scientific evidence suggests that before you change your diet, you really need to look a few things. You need to look at what the person is currently eating, the medication that you're on, any treatment, also the composition of your urine. So, for example, if you have a leaky kidney, that's leaking protein, as well as your blood results. So the changing in your diet should really follow our dietetic assessment. The main changes will be a reduction of salt and salt intake of salty foods, particularly if your blood pressure is high, or particularly if you suffer from something called proteinuria, so when your kidney leaks protein. Another consideration is the overall evaluation of how much protein you eat in your diet. Sometimes when your renal function is low, the doctors may advise you to limit the amount of fluid, or maybe even increase the amount of fluid. And for people that maybe are on specific medications, they may need to follow special diets, like limiting the amount of potassium or limiting the amount of phosphate. But the reality is that a lot of people, and I see that a lot with my patients, they think, oh, well, I need to do this because I want to do something about the diet. The advice that I always give to my patient and the people that I see is try to discuss it with either a nurse or a doctor or a dietitian, because sometimes I see people that try to do it themselves and they put themselves in a restrictive diet that there isn't a need. The diet would not necessarily have caused the kidney cancer or the kidney disease, but in some people it may help during the treatment.
And we hear a lot of talk about a healthy diet, but what is a healthy diet? Can you give me an example of a healthy plate?
Usually a diet, first of all, it's rich in fruit and vegetables. So after your plate, about 50 or even 60% of the amount that we should aim at should be fruit and vegetable. I'm sure most of you probably heard the 5 a days. So to having 5 fruit and vegetable a day, and actually recent evidence suggests that should be the minimum. The second part is to really limiting processed food, and by processed food we mean food that's already pre-cooked and ready to eat, like such as ready meals. They could be either fresh or frozen. So food that has a very high content of salt, but also additives and preservatives, together with sugary food as well, and what we call saturated fat. So food, for example, like hard cheeses, they contain quite a lot of saturated fat. Um, I would say probably 50% fruit and vegetable, and the rest you get probably a 20%, 20 to 30% of carbohydrates, so potato, pasta, rice, and then the remaining 10-15%, 15-20% should be protein. So for that we mean meat, or white meat preferably, but also fish, eggs, pulses, or vegetarian or vegan sources, so things like corn, for example. They're all part of our own healthy balanced diet. Throughout a week, so a 7-day, then probably 4 or 5 you should aim to healthy balanced diets, and then maybe have 1 or 2 days where or 3 or 4 meals during the week, or even 5 where you have your treat. So we say we moderate everything with moderation.
The other thing, obviously, talking about intake is the amount of fluid that we should take in a day. And is there a recommendation around that?
Yeah, so the Department of Health, they've got what we call the Eat Well guidelines, and they recommend 6 to 8 glasses a day of water. In the context of kidney issue, I think it's very important to maintain yourself well hydrated, and not only the quantity is important, but also the quality. So what do you drink? I personally am a big fan of water. It's the best drinks, doesn't contain calories, doesn't contain any additives. But tea, coffee, or other drinks, they obviously can be included.
We've had some questions with regards to side effects, because many of our patients are on medication and treatments that create side effects for them. And 2 of the side effects that are particularly common are constipation and diarrhea. So what I really wanted to ask is, with regards to diarrhea, is there a diet regime there that would help slow that down? And are their drugs less effective if they have diarrhea? Are they losing out on some of their treatment then?
Yeah. So diarrhea is common in people with kidney cancer, particularly while they're on treatment. So the first things when somebody suffers from diarrhea is try to replace your losses. So try link to fluid. Try to, at the very least, to try to drink little and often, and to try to drink a little bit more. Sometimes it's very difficult to eat, so people usually recommend to try to forget your big 3 meals a day, but try to eat little and often throughout the day. Some people reported that eating dry food may help. So, for example, toast, rice, or in terms of eating while you're having diarrhea, it's whatever you manage to eat, really. Some plain, simple food may be better tolerated, particularly herbs or spices or very hot or chili. Probably should be avoided when you have diarrhea, because they can make things slightly worse. But again, it's whatever you can tolerate. There are preparations over the counter like Imodium or stronger medication like loperamide. But before we start them, I always say to my patient that it's always best to refer back to the oncologist. The second part of your question was, are drugs less effective? But if the drugs are taken orally, then that could affect the absorption of some of the drugs. And this is another reason why we always say make sure that you tell your oncologist, your oncology team, really. But even with constipation, one of the things I tend to say to my patients, make sure that you're well hydrated. So constipation could be a sign of dehydration if you're not drinking enough, but also if you're not moving enough. And with movement, I don't mean you have to do a run, but simply get out of bed, do a little walk or move around the house, or do the stairs once or twice a day at your own pace. Little things like that can make a huge difference with constipation. Of course, there are drugs that may induce constipation or the side effect of treatment. So you can increase the fiber intake in your diet. That would be probably my first call. So what does that mean in practice? So wholemeal bread or seeded bread, maybe high in fiber, so they may help you to go to the toilet. The second call is to have plenty of fruit and vegetable that contains a lot of fiber. Usually fruit with seeds and the skins that tend to be quite high. So kiwi, pears with the skin, or apples with the skin. Obviously plums, they're very high in fiber. Dry fruit are very high in fiber. Nuts as well, and also all bran. So there are quite a lot of things that you can do with your constipation before you consider medications.
So all there is left to say is to say thank you very much, Bruno, for your time in helping us with this and helping us make this Ask the Expert video. Thank you.